So Lyme disease is caused by the Spirochetes Borrelia burgdorferi. It's transmitted by Ixodes scapularis, the deer tick, and other Ixodes species. The pathogenesis, ecology, and epidemiology are well described. Antimicrobial treatment is very effective. Complications are rare. That's really all you need to know about Lyme disease. Thank you. It's true that the sensitivity is very poor in early disease. False positive results for IgM antibodies are extremely common. Criteria for a positive Western blot is probably too liberal. The other thing to remember is a Western immunoblot does not equal truth. You cannot interpret it without an ELISA. If you just have a positive blot, even an IgG blot, uninterpretable. You need to show that the quantity of antibodies is elevated. Then the blot means something. If you're not sure if something is erythema migrans, there's no emergency. It's only Lyme disease. It's not HIV. I've actually never seen late neurologic disease in a child. It's vanishingly rare. There's never been a documented case of congenital Lyme disease. It doesn't exist. So here's a quiz. What symptoms would make you want to test somebody for Lyme disease? The correct answer is none. There's no evidence that chronic Lyme disease exists. Moral of the story is don't order Lyme titers on those patients. Otherwise, you have to refer them to the Lyme disease clinic. You don't want that. So should you test the tick? The answer is no. Once you identify it, there's no reason to test it because it just causes undue anxiety. Should you test a child for antibodies? No, definitely not. It's only Lyme disease, not HIV. And internetectomy. It's hard to perform, but if you can do it, it's pretty effective. And I recommend it for all your patients with Lyme disease. What is chronic Lyme disease? What's the definition? It turns out there is none. There's something called medically unexplained symptoms, which are physical symptoms with little or no basis to attribute to an underlying medical disease. Laboratory tests should be avoided in these patients. Psychosocial factors propel and amplify the symptoms, the belief that one has a serious disease. There's a stigma associated with these medically unexplained symptoms. Convince them that they don't have some horrible underlying something that's going to do them in. The big thing is get them back to work, school, up and going. How do you prove to these patients that have chronic symptoms that it's not Lyme disease? If the result is positive, I still don't think it's Lyme disease. It could be that you were exposed 10 years in the past and it has nothing to do with it. It's a mixed message if you say, I know it's not, I don't believe it, even if it comes back positive. Well, why are you doing it? So how do you prevent the patients from coming to you in the first place if you're not going to do anything for them? And it's a good idea if you can convince the referring doc not to refer or to refer to somebody else.